Hi, I'm Chris.
And I'm Angela.
And we are the makers of this film.
Along with Edgar Mendez, who couldn't be here today.
The concept for the film came out of a series of discussions we had at Cascade AIDS Project surrounding our curiosity about what happens when somebody tests newly positive, short-term and long-term, and what they can do with their lives.
The movie is also really about the fear of getting tested for HIV, and we think that a lot of the fear comes from not knowing these short-term and long-term things.
So our intention was to make something that would answer those questions and hopefully make people more comfortable with the testing process.
So we're going to follow Caitlin through this process and see what happens to her and what happens to her after she gets her results. Enjoy.
Hey, are you here for chat room?
No, I'm here to get tested for HIV.
Okay. So yeah, just fill the survey. It'll ask you what brought you in today, how old you are, and just make sure you check the box that says you want your sugar test, and then I'll set that up for you.
Okay, thanks.
Come on in. I'm Sai.
I'm Caitlin.
Hi, Caitlin. Nice to meet you. Have a seat.
Okay, thanks.
So, what brought you in today?
I want to get tested for HIV.
Okay. Is there any specific incident or anything like that that prompted you to come in?
No.
Okay. Great. Well, how this works is we have some paperwork to do. It takes a few minutes, and then we'll get the test started. And it's a rapid test, so it takes 20 minutes for the test to develop.
Okay.
During that time, we'll have more paperwork, and we can have a conversation about risk and that sort of thing. And at the end of the 20 minutes, we'll look at your test, and that's how it goes. Do you have any questions?
Not yet.
Okay. All right, so the first decision you get to make is whether you want to test anonymously or confidentially. And the difference is an anonymous test, we don't record any of your name, phone number, address, anything like that. A confidential test, we do take contact information, and that's used in case of a positive test. That information is used to get in touch with someone and make sure that they have all the resources they need. If you test confidentially, we can also give you a copy of your results. So, do you have a preference?
I'll get tested anonymously.
Okay. So I'm going to sign this paperwork for you so it actually stays anonymous.
Okay.
This is the privacy practices acknowledgement. Did you get one of those outside?
No.
Okay. This is a copy.
Okay.
It's just like a doctor's office. It says that we'll keep your information confidential and follow HIPAA policy practices.
Okay.
If you're comfortable with that, I'll go ahead and sign this for you.
Okay.
And then this is an informed consent form, and it basically says you're here for a rapid HIV test, and we want to make sure that you're prepared to receive your results, whether they're positive or negative, in 20 minutes. This test also looks for HIV antibodies and not the HIV itself. So there's a 3-month window period where if you were exposed to HIV in the past 3 months, it may not show up on this test. Do you have any concerns about the past 3 months in particular?
Not in particular.
Okay. Have you had an HIV test before?
No.
Okay. So, for the rapid test, we have a couple options. We can either do an oral sample or a finger stick sample. The oral, you just run it along your gums, and the finger stick, I just take a drop of blood and use that for the sample.
Okay, I'll do the oral sample.
Okay. So, take this, and I'm going to show you with this tongue depressor. Like I said, you're going to run it along your gums, and you don't need to rub it along your cheeks or anything like that. Start in the back, go all the way around, and then on the bottom, so top and the bottom.
Okay. Should I just do it?
Yep. Okay, and go ahead and stick it in here.
In this?
Yep.
Okay.
And then you're going to start the timer. So the next questions are real personal questions about sex and drug use, and you can decline to answer any of them. That's totally fine. And I'm just going to ask them all the same way. So Some of them may not apply to you, and that's fine. The first ones are about the past year. So in the past year, have you had vaginal or anal sex with men?
Yes.
And would you say you use condoms never, sometimes, or always?
When we have them, but
Okay.
if they aren't available, then I'd still have sex.
Okay, sometimes?
Yeah.
Okay. In the past year, have you had sex in exchange for money or drugs?
No.
In the past year, have you had sex with someone who is anonymous to you?
No.
Okay. In the past year, have you had sex with a man who also has sex with men?
I don't think so.
Okay. In the past year, have you had sex with someone who you knew injects drugs?
No.
In the past year, have you had sex with someone who you knew was HIV positive?
No.
And in the past year, have you used injection drugs?
No.
Okay. Okay. Great. Well, now is our chance. We have about 17 minutes where we can use this time to talk about whatever we want. So it's your chance to ask me any questions you have about HIV or other STDs. We can talk about the risks, some of your risk factors, and if you want to reduce your risk or if you're comfortable with your risk. Do you have anything you want to start with off the bat?
Well, the test, the swab, what exactly is that like doing right now while it's sitting in that thing?
So it takes a sample, an oral sample, and it uses that sample to, I don't know exactly how the test itself works, but it looks for the HIV antibodies. And there's a couple lines in the test. So if there's one line the one line shows you that the test is working correctly. So it gives us a sense of if it's in the wrong place, then it might be malfunctioning, or the temperatures are wrong, or something like that. If there's two lines, then that second line shows that HIV antibodies were detected. So it's going through different colors and looking at the sample, and then within that 20 minutes, we'll see what it says.
Okay.
Does that make sense?
Yeah. So if it comes out as positive, what does that mean? Is that a final thing?
So these tests are, yeah, that's a good question. They're rapid tests. So if we have a positive, we actually call it a preliminary positive, because we have to do a second test to determine whether it is a positive. There's a very small margin of error with these tests where there are false positives. It's really, really rare, but it can happen. There aren't reported false negatives. So if it's a negative, then as long as you're not concerned about the past 3 months, then a negative test is a negative test, and you can come back and get another test in 3 months. If it is positive, then we call it preliminary positive, and we do a second test. And that can either be an oral sample or a blood draw. So, and there's a couple things, I mean, I can talk more about what happens if there is a preliminary positive, but that's kind of the general how it works.
Okay.
Yeah. Do you want to talk more about the sex you're having? Are you ready to see your results?
Yeah.
Okay. So your test is preliminary positive.
I guess I'd want to say it's not the end of the world. You know, an HIV diagnosis is not the end of the world. It's serious, it's shocking, but it really hasn't stopped me from doing anything that I wanted to do with my life, and it's far better to know. When I talk to other people, when I go to conferences and I meet other activists and I meet other people living with HIV, I'm amazed and I'm reminded that this is simply a virus. It doesn't strike you because of what you do or who you are. It's a virus, and it's not any different than cancer or any other kind of illness. The one thing about this type of illness is that we can test for it and we can treat it. So if you're worried, get tested and get treatment, and it's not the end of the world.
When
you're doing rapid HIV testing, if you get a preliminary positive, as a tester, because of the way I test, I don't actually see the test before the person getting tested sees it. So we would see a test and we would see that there's a preliminary positive. And at that point, we would talk about how that person's feeling and what that means for them, and kind of what I would assess what their emotional state was and if they needed some time to just think about it.
The testing experience is not as scary as most people think it is, and there's a lot of support around your results.
We want to make sure that we can provide the services that our community needs. However, we want to make sure that safety is number one. Make sure that the person, in the event the person hears a not so desirable outcome, the person doesn't hurt themselves or hurt somebody else.
We have a couple options. A person can do a confirmatory test here at CAP. They can do a blood draw with the county in order to, if they feel more comfortable getting a blood draw rather than an oral confirmatory test. If they want to make an appointment to get their confirmatory later, we can make an appointment to do that. And if they want to get it right away, we can do it right away. If they do a confirmatory test at Cascade AIDS Project, we make an appointment for them to come back 2 weeks later and receive the results. The confirmatory test doesn't actually take very long, but that time after finding out there's a preliminary positive, in general, will take a while. It'll be some talking about how the person's feeling. They might have questions about what this means for them. They might not want to hear about any resources. They might want to hear about resources. We kind of have all those options available. After doing a confirmatory, if they choose to do a confirmatory, or after, if they decide not to, we have a packet, a preliminary positive packet, and we would give that to the person, and it has information about kind of what's next for someone who tests preliminary positive, and as well as contact information, like emergency hotline information.
They will get assigned a case manager, and that case manager will help them get connected with medical insurance in case they're lacking of an insurance.
I work a lot with folks who don't have insurance, and Oregon has pretty good access to, if you're HIV positive, there's pretty good access to care in terms of signing up for health care, and healthcare that pays for medications if you have no income, that sort of thing. So if you have no income or a low income, there's support for getting medications and getting enrolled in healthcare plans. For everybody I've worked with, that hasn't so far been a barrier.
It is a very thorough appointment. Usually clients are there between 2.5 up to 3 hours, where they get a very comprehensive medical history, sexual history, social history, and they get a whole battery of tests.
There are education and support groups available. I usually give folks some reading information so that they have the option to find things that they're interested in at their own pace, and you can tell them to ask me questions as they're ready to find out about new services.
One of the biggest reasons that people don't get tested, which is stigma. HIV stigma is very real. HIV stigma keeps people from being tested. It keeps people from asking their sexual partners whether or not they may be at risk. It keeps you from protecting yourself. There's still a lot of work to do. It still is very sad to hear young people are testing positive. And it's important to remember that you'll get over your oh shit moment. Be there to take care of yourself. Be there for your friends. ask your friends to be there for you, take advantage of the resources that are available, and just take one day at a time.
So those were the answers that we found that were the most comforting for us.
And we hope that those answers were inspiring and can help other youth, our peers, get over their fears of getting tested. Go get tested for HIV.
Yeah.